In Australia, suicide is the biggest killer of men aged 18 to 40. Just let that sink in for a minute. It's not cancer, it's not car accidents. On average, every day, 6 men take their own lives, and up to 82 men will call an ambulance for suicidal thoughts or attempts. That's a terrifying statistic. This talk can help you stay mentally healthy, but it's also aimed at helping you to help your mates and your family members to identify the risks around mental health and to promote mental health within our clubs and your communities. Up to 50% of the population at some stage in their lives will experience a mental illness. It's now time for us to talk about this and to break down the stigma around mental illness. And being a part of a sporting club can be one of the best things that you can do to promote mental health and to avoid mental illness problems in the future. Being part of a team, being part of a community is a great way to stay healthy. We all have a social responsibility to our communities and to our families to promote good mental health and to break down the stigma around mental health. And for me personally, I'm a father of 2 young sons, and I'll do everything I possibly can do to stop them from becoming a part of that awful statistic. This is Bouncing Back. So what promotes good mental health? Having a good social network and being part of your community. Being involved in sporting events and being physically active. Having fun and eating well, making sure you have a balanced diet. Limiting drug and alcohol use. Try to be aware of what you're putting into your body and the negative impacts that can have on your personal well-being and your mental health. And of course, talking about your mental health to others and feeling as if you're supported. So what can cause poor mental health? Everyday stresses of life, with family, with work, big changes, a new job or moving home. But sometimes there seems to be no reason whatsoever for a mental illness to occur. It just happens out of the blue. We know that 85% of people who experience a mental illness will experience it before the age of 25. There are so many factors that could contribute to a mental illness. So what happens if I have a mental health challenge? Well, the good news is about 80% of people who suffer from a mental illness make a full recovery and go on to live a normal life. For most people, they come out stronger and wiser from experiencing a mental illness. Others, they learn to live with it, and they learn the strategies that they need to put in place to live a normal life. Having a mental illness doesn't mean that you're broken. It doesn't mean that there's something wrong with you. It just means you're experiencing something that 50% of the population experience. You can learn coping strategies and you can find where to get supports to help you through it. And one of the biggest things to remember is that it's not a sign of weakness to have a mental illness. So what are the types of mental illness? We're going to have a look at the most common ones that we experience: anxiety and depression. So let's talk about anxiety. What is anxiety? When anxious feelings just don't go away, when they happen without any particular reason, and they make it hard for you to cope with your daily life. To try and explain it, imagine that you're walking through the forest and you're having a nice little stroll and the sun's out and it's a beautiful day, and then through the forest runs this huge giant bear, and it's mashing with its jaws and it has massive claws and it rears up 10 feet in front of you, and your heart is beating at 1,000,000 miles an hour and your endorphins are rushing and you're panicking and you're stressed and your fight or flight responses are right at their peak. Imagine that feeling, but there's no bear. For people who suffer from anxiety disorders, that is the feeling that they can get for no reason whatsoever. They might wake up at 3 o'clock in the morning and feel that, their heart beating. They might feel like they're having a heart attack. It's important to understand some of the symptoms of an anxiety disorder. And then, if that's what you think you might be suffering from, then you can go and get help. Anxiety is not a sign of weakness. It doesn't mean that you're just stressed. It can be a serious illness and you can get help for it. So what is depression? Well, we all feel sad or moody or low at times, but some people will experience these feelings for extended amounts of times, for days, for weeks, for months, or even years. I've personally suffered from depression for my entire adult life, and for me the story of the black dog, or the image of the black dog, really sums up how I feel. When I experienced depression, I realised that I feel nothing. I don't feel sadness. I don't feel joy. I just feel this nothingness, this empty void. And I think that the most important thing that's helped me get through my depression is being able to talk about it with my family and open up about it with my mates and my friends. And then I find out that some of them suffer from the same issues. And then that commonality of understanding is a great help to overcoming it. Depression is really serious. It's something that has affected my life, but I've learnt how to live with that depression and how to acknowledge those feelings when they come up. So how do we identify if someone is feeling anxious or depressed? What sort of behaviours should we be looking for? Well, you might notice that they appear to be down or flat for some time. You might experience different behaviours that are uncharacteristic for them. They might get angry quickly, or they might avoid conversations. They might not turn up to training, or they might become withdrawn or irritated. You might notice that they've begun to lose confidence, or they might just seem to be unhappy or to have lost their sense of humour. When you notice these things, it's time to have a conversation. See if you can find out what's going on and if you can help. So what can you do if you think that a mate or a family member is suffering from anxiety or depression, or they're just not doing well? Well, here's some of the tips that might start a conversation that could lead to them getting help. Really simple. Number one, talk to them. Ask them, how are you going? Are you okay? Identify that you've noticed that they're not acting the way they normally would, or they appear to be a bit low. If they want to talk about it, just listen. You don't have to rescue them. You don't have to come up with amazing ideas on how to make them feel better. Just be there and listen. Ask them what you can do for them. Ask them what sort of help they might need. Or encourage them to talk to a family member, a spouse, their mum, their dad. Or if you think that they want to talk to a GP, they can talk to a GP. And if you're really worried about someone, that's when you can encourage them to get extra help. Encourage them to call Lifeline or Beyond Blue or any of the number of support services that you can get online. Or if they're under 25, they can call Headspace. All of these services will help you and your mates and family members to work through what's going on for them. They're amazingly effective and they're so underused. Part of the reason why Bouncing Back is here is to encourage people who aren't likely to use these services to use them before things get bad for them. So if they don't want to talk about it and they don't want to open up, well, that's fine. Just let them know that you're there for them. Keep an eye on them. Send them a text. Maybe go out for a drink or go out for a walk. If you feel that it's really important and you're worried that they're at risk, talk to a family member. And once again, encourage them to talk to a GP or a support line like Beyond Blue, Headspace or Lifeline. Suicide. Every day in Australia, 6 men take their own lives and up to 82 men will call an ambulance due to suicidal thoughts or attempts. So we need to learn to understand what we can do if we're concerned for a friend or ourselves when it comes to suicide. If someone is talking about or thinking about suicide, you need to get them help. Look for the telltale signs. They might be talking about not wanting to be alive anymore. They might openly say that they want to die. And that's the time when you need to get them professional help. Reassure them, stay with them, and let them know that you're there to support them. Listen to them, but don't offer them advice. Just be there to offer support and to keep them safe. Assist them to call a helpline. You can sit together and put the phone on speaker, and you can both talk to the counsellor from Lifeline or Beyond Blue to get advice and support. And if you're really worried, you may need to call a spouse or a mother or a father or a family member to get extra help and support. And if you're really concerned that your friend or your family member is at risk of suicide, you can call an ambulance or you can take them to hospital yourself. There they'll be safe and they can work through their issues with professionals. So what can we do now? It's vitally important that we create mentally healthy, inclusive, diverse, community-based sporting clubs, a place where everybody feels safe and everybody feels welcomed. We need to talk about mental health. We need to encourage our mates and our families to talk about their feelings. We need to change the culture in our clubs from the toughen up princess or the eat a bag of concrete days of old to creating a club where people can openly express how they're feeling and encourage support from other members of the club. We need to show support. We need to let people know that we're there to help them and that we're there to listen to them and that we want them to be part of that community. Finally, we need to look out for each other. Be aware if someone isn't acting the way they normally act. Be aware if they appear low. Be aware if they're not as funny as they used to be or they haven't turned up for training. If someone hasn't turned up for training for a couple of weeks, send them a text, give them a call, check up on them. It's really important that we do this because sometimes that might be the one thing that brings a person back into the light when they've been in a really dark place. And that's what real community is all about. And that's what Bouncing Back is all about. If you'd like any more information about the Bouncing Back program or you'd like to book a session for your club, you'll find all of the contact details at the end of this video. Thank you so much for watching, and together we can create more mentally healthy, inclusive, happy sporting clubs and communities.